Hi, welcome to the class. This is our third class. We completed, our last class was all about what can go wrong with the brain and things that might cause aphasia. Our topic for today basically is how do we know what we know about brain and language relationships? We all kind of came into this class and into our field thinking that the brain certainly is responsible for language, and certain parts of the brain are perhaps more specifically responsible for specific parts of language. That's a given in today's day and age. How did we get there? One has to remember that up until, and I think I've said this and I know I'm going to say it again, but up until 1970, when CT scans were introduced, the only way, really, that anyone knew about what happened to the brain when language was affected is to wait for the patient to die. And then look at the brain in autopsy and to see what was damaged. And then make a conclusion, to draw a conclusion, that, the damaged part of the brain must have been responsible for the function that was lost. So if the person couldn't speak well and area X of the brain was damaged, well then area X was responsible for that function of speech. If the person didn't understand and a particular part of the brain was damaged, then we have to assume that that part of the brain that was damaged was responsible for understanding, and so on and so forth. There's a logic to doing that, but it's fraught with potential for error, and it has happened. Probably the biggest problem is something called history, and that is it's hard to know exactly when that part of the brain was damaged. Do we know that that part of the brain was damaged at the same time that the function, that specifically for our case, the language function was lost? Could that have occurred at a totally different time? In which case our conclusion is wrong. It's absolutely wrong. There are other issues also that make that method less than fully reliable, but it's what we had. It's what everyone had. There really was nothing else left. One of the major proponents of doing this, and a person whose name you definitely know by now, but let's describe him a little bit, and let's describe his case. He really had one case that he became famous for, and that man is Paul Broca. You can see a photo of him. You're going to see that when I describe people, I've spent some time researching and finding pictures of them. It helps me. I hope it helps you too. I kind of like to know what they look like, know a little bit about them. Paul Broca was born in 1824, and he had a patient who became really famous in medical lore and in speech pathology and aphasia, whose real name was Le Borgnier. That's his last name, his family name. But he's probably better known as Tan. Tan. T-A-N. We'll see in a minute why he was known that way. His first name was actually Luis, but very few people actually refer to him that way. Again, almost always just as Tan. Tan was born in 1809. We don't know an awful lot about him, but we know something. We know that in his youth, I don't know exactly what that means, but let's say in his teens, we'll just state, he demonstrated epilepsy. And he had quite a number of seizures, but they didn't stop him from working. He was reasonably intelligent. That we can conclude because he had a profession. His profession is something that we wouldn't know about today because it's something that doesn't exist any longer. But that is, he is a person who actually created forms of the foot And he did that so that a person who made shoes and boots would be able to make a proper shoe or boot for an individual. People didn't have shoe closets in those days. People had a pair of boots. Maybe a pair of boots and a pair of shoes if they were wealthy. When they were made to last, which is something we probably can't say today, huh? But they were made to last, they were made well, and they were made, again, you didn't buy it on a shelf. They were made custom. Le Borgnier's job was to create a form of the foot so that the bootmaker can make an appropriately sized shoe or boot for the individual. It's a responsible job. It didn't make a person rich, but it was certainly a living in those days. And so, again, it's just something to give us an indication that he was a reasonably intelligent person. We don't know anything about his education. We really don't have any data about that. What we know is that when he was around the age of 30, for reasons that are really not 100% clear, he stopped talking. He no longer spoke, and never spoke again, for that matter, not on a voluntary basis. He never did speak again. He was admitted to hospital, and that's the hospital. I'll talk about the hospital in a second. He was admitted to hospital, and he spent the next 20 years there. Why did he do that? Not because he was critically ill, not until the last few years, but because basically he had no place to go. The hospital did not discharge him before they had the kind of medicine that we have today where, every day counts. But they just kept him there because they really had no place to send him. They didn't think he was capable of taking care of himself, given his inability to speak. He seemed to understand. He didn't seem to have any trouble with that. What he did do in terms of communication is you would ask him a question or say something, and he would go into a response mode and say tan, T-A-N, tan. And he would articulate that well, and he would say it with normal inflection, and he would put it all together and say, how are you today? Tan. Are you feeling any better? Tan, tan. And so he would give you what appeared to be phrases and sentences, but the only word in there was tan. Once you've seen, and once you have the experience of working and seeing patients with aphasia, you will meet people who have that type of behavior. It may not be tan, and it probably won't be. That would be odd. But perhaps other words, or pseudo words. Again, I wanted to just, before I move on, to show you this picture of the hospital. I am so overwhelmed that this building was built in 1830. This is by hand. And this is a hospital. We're not talking about building a fortress or a palace. This is a hospital. Every time I look at it, I'm actually kind of overwhelmed with the size of it and the beauty of it. I'm not an architect, but I'm impressed with it. Okay, so Tan, which is how everybody referred to him, was in the hospital. He was going to stay there. After 10 years of being there, and now he's around 40, or in his early 40s or so, a medical condition developed, including the gradual paralysis of the limbs on his right side and impairment of movement. Within a few years, he was bedridden, and he actually spent the last 7 years of his life in bed. He never did get out again. He was just unable to move the right side of his body. And this is all before rehab and everything else that we know about. Note, by the way, that it's a gradual paralysis. It was not sudden. It didn't happen overnight. He developed this. Knowing what you now know about stroke, you may want to conjecture, but you can't go much beyond that, what type of brain pathology he may have had, that he would have had a gradual development of paralysis, but that's 10 years after he stopped speaking. Okay, let's not lose sight of that. 10 more years later, okay, now he's 51, he was transferred to the medical care of Dr. Paul Broca, who tried to find out about him and tried to get a history. He didn't know him before. He just became his doctor at that point. The reason Dr. Broca was called in had nothing to do with his inability to speak, or his paralysis for that matter. He developed a very severe case of gangrene, which is systemic poison. And his leg was, they really thought they were going to have to take his leg off so that the poison, the gangrene, would not spread to the rest of the body. They only thought about this for a couple of days, and then, unfortunately, the patient died. Le Borgnier died at the age of 51 in the hospital. Broca saw the opportunity and said, you know what, we need to look at this brain. We need to see what's going on. And they performed an autopsy of Le Borgnier's brain, and they found tissue malformation in the posterior inferior frontal gyrus of the patient's left hemisphere. Okay, let's go over that. Posterior means the back part. Inferior means the bottom. Frontal gyrus in the frontal lobe. Okay, that today, if you would look at any anatomy book, it doesn't say that. What does it say? It says Broca's area. Because the medical convention then named that part of the brain Broca's area on the left hemisphere. What Broca concluded and reported at a conference just a few months later, that part of the brain is the center of articulated speech, and he called the disorder aphemie, A-P-H-E-M-I-E, a French word, which means without words, without speech. For whatever reason, that name never really did take off. But what did take off, and it's unclear who supported this name, was the word aphasia. And that became accepted, till today, obviously, in the medical world. And so the speech and language problem that results from a disorder of that part of the brain is called aphasia. What we have, Le Borgnier's brain still exists. It still exists. It is in France. It was preserved. Many studies have been done on it. You can see, we're not going to belabor the anatomy here. I'm not sure I'm capable of doing that, frankly. I'm not sure it's that important. But you can see the obvious distortion of the brain right here. And again there. And that's just close up. That's actually a different patient, Lalong. This is Le Borgnier. And these are MRIs that have been done on Le Borgnier's brain. And it's very consistent with lesions in Broca's area. Okay, just to recap, this patient, Tan, could answer questions with gestures. He could say a few curse words. I'm not sure I mentioned that, but he did do that. But typically he said Tan, and he found the lesion in the area that we now know to be Broca's area, the left frontal lobe, posterior part, inferior part of the brain, of the frontal lobe. Okay, we're going to stop. We'll move on to another tape.